Guilford County joined a list of North Carolina counties scheduled to get an allotment of monkeypox vaccines. The health department recently learned it would get a shipment soon. The county says it's working with Forsyth County to make sure Guilford residents can get vaccinated. County health leaders say they're not sure how many doses it'll receive from the state. Vaccine supply is limited everywhere. Only a select group of high-risk people can get the shots right now. The White House says it is working to increase supply.
There were more than 300,000 vaccines across the country in a matter of weeks, and we quickly ordered the production of 5 million more vaccine when we saw that the virus was starting to spread.
The doctors hope the threat subsides once the vaccine is widely distributed. Right now, the focus is on testing and ensuring that people who get the virus can also get the treatment. The reemergence of monkeypox has created lots of questions. How exactly does the virus spread? How concerned do you need to be? Our Verified team dug into what you need to know about the illness.
Monkeypox is a new virus.
False. Monkeypox is not a new virus. Monkeypox was first described in the medical literature in the 1950s and has been infecting humans since at least the 1970s.
Monkeypox came from monkeys.
False. Although monkeypox is called monkeypox and was first described in monkeys, its original host or its natural host is some unknown animal, likely a rodent.
Monkeypox was created in a lab.
False. There's no evidence that monkeypox was created in the lab. In fact, it was first described in the 1950s when there weren't even those sophisticated technologies to make a virus in a lab.
Monkeypox is a sexually transmitted disease.
Although there is some data to show that the virus can be found in sexual fluids, it's primarily passing because of close contact that's inherent in sexual activity, not necessarily in sexual activity.
Monkeypox only affects gay and bisexual men.
False. Monkeypox can infect anybody, but what's happening in this outbreak is that it's heavily concentrated in a sexual social network. So we're seeing cases almost exclusively in men who have sex with men, although there have been some cases in other individuals.
Monkeypox is not as highly transmissible as smallpox or COVID-19.
True, monkeypox is not a very contagious disease, and it's certainly not as contagious as a respiratory virus like COVID-19.
Another common claim refuted. The doctor says you're unlikely to get monkeypox from bed sheets or trying on clothes at the store. He says the risk isn't zero, but it's pretty low. The spread of monkeypox is worrying some doctors. The virus is not new, however, yet it is still spreading quickly around the U.S. We have treatments and know how it spreads. The former FDA commissioner says he thinks we made a lot of the same mistakes as we did when COVID first appeared.
This is a slower moving virus, which is why we could have gotten control of this if we had been more aggressive up front. We made a lot of the same mistakes that we made with COVID with this, having a very narrow case definition, not having enough testing early enough, not deploying vaccine in an aggressive fashion to ring vaccinate. But now this is firmly embedded in the community.
The government plans to ship out hundreds of thousands of doses of the vaccine this week. And we can't forget about COVID, which is still spreading in our community. Hospitalizations rose for the fourth straight week in North Carolina. The state reported just under 1,300 patients this week. Locally, Guilford County's percent of tests coming back positive shot up to 20.4%. That's 4 times the county's goal of 5%. Health experts say the new variant appears less deadly than previous versions. On Monday, a Cone Health doctor told us she attributes fewer severe cases to widespread exposure to the virus and pre-existing immunity.
The key thing of that, we have to consider that a majority of the population has either been vaccinated or has had natural infection, maybe even once or twice already.
The doctors also say viruses tend to get less severe as they mutate. We've seen that trend throughout the pandemic. President Biden is officially out of isolation. He tested negative for COVID today after getting sick last week. The White House says Biden had a mild case of the virus, and doctors credit the president's double vaccinated status. He also took the drug Paxlovid, which helps prevent serious illness. The president says he feels great now, but it's a reminder COVID remains a threat.
BA5 means many of us are still going to get COVID, even if we take the precautions. That doesn't mean we're doing anything wrong. Unfortunately, this COVID is still with us, as it has been for 2.5 years.
Biden says getting vaccinated is still critical because it'll keep people from getting really sick. A troubling trend in this phase of the pandemic, experts say the newest COVID variant is more likely to cause reinfections. The World Health Organization says there was 90% protection before Omicron became the dominant strain. Well, now it's only 40% protection. Doctors also say studies suggest someone with immunity from a vaccine or prior infection had a weaker response to the new variants.
If you were infected with BA1, you really don't have a lot of good protection against BA4-5.
Another concern, the newer variant seems to have short-lived immunity. A study suggests people who get this strain of the virus only get about 3 or 4 weeks of solid protection. The doctors say the reinfection issue could be resolved once an updated vaccine is authorized. Right now, experts hope a more effective version is released in the fall. Some doctors have raised concerns about the nature of the virus since it mutates often. By the time an improved vaccine is available, a more formidable form of the virus could be the dominant strain.
The issue, though, is we know variants continue to emerge, the virus continues to mutate, so we don't know, even by this fall, BA5 may not be the variant. We may have something else, and we're kind of chasing our tails right now, trying to keep up with the virus. By the time we figure out there's a new variant, develop an updated vaccine, we might already be on to a new variant.
To account for mutations, doctors are working on a universal vaccine that targets a specific part of the virus, making it weaker. Now, the origins of COVID remain unclear more than 2 years into the pandemic. 2 new studies support the idea that it originated in the wild, not a lab. One study published yesterday says the virus likely emerged in a Chinese seafood market and spread from animals to human. The other study maps 150 possible locations for its origin. Researchers say the widespread possible starting point might have been a natural development of the virus.